You mentioned earlier a CT scan or an MRI. So are those the two types of tests that can be used?
Those would be the best types of tests to use in a patient if you're suspecting pancreatic cancer. And again, if you have some symptoms and maybe a family history, you'd want to get an MRI or CT with contrast, utilizing a pancreatic special protocol to look at the pancreas and evaluate for lesions which might be cancer. You wouldn't want to get an ultrasound, for instance, because an ultrasound might not look at the entire pancreas. It could only see parts of the pancreas, and of course you need to see all of it to say whether there's cancer there or not.
Okay, now is the contrast, is that what you have to drink? Is that something that's injected?
Right. So in this case, the contrast is something that's injected into your veins and can be thought of as an image enhancer, or some patients call it a dye, even though it's not a dye.
What is done if the CT or MRI finds something suspicious for pancreatic cancer?
So if something suspicious is found, usually a patient goes right for biopsy to get a piece of the tissue to say if it is cancer, and if it is, what type of cancer is it. Sometimes the CT scan is so suspicious and it might show evidence of metastatic disease or spread of the tumor to other parts of the body, in which case, before they do a biopsy, they might want to do whole body imaging. So that could be with a CT scan of the chest, abdomen, and pelvis, or a PET CT, which is whole body imaging, utilizing nuclear medicine and CT together.